Dr. Pavna Sodhi and Dr. Surinder Sodhi. Chapter Introduction.
Hi, my name is Dr. Pavna Sodhi, and this is my father, Dr. Surinder Sodhi, and we co-authored this chapter on intergenerational trauma within the Punjabi-Sikh diaspora. I'm currently a psychotherapist and a adjunct professor who lives in Ottawa, Ontario, and my father is a retired professor in educational counseling at Dalhousie University, and he also is a registered psychologist and still seeing clients on a weekly basis. We chose to work on this project as we thought it was really important and dear to our heart, and we wanted to inform others of what trauma, and specifically intergenerational trauma, looked like within a Punjabi-Sikh context. So the way the chapter is divided up, it discusses a bit of the historical piece around Punjabi-Sikh, the Punjabi-Sikh diaspora, and then we also offer some other theory around Punjabi-Sikh culture. And then we talk about some of the practical applications that could be used with your BIPOC or multicultural clients. So, Dad, what did we learn about working together?
Basically, Pavna, it is like this, that I am the first generation, you're the second generation, and Nadia is the third generation. So it was very interesting to answer questions about the nature of raising a second generation, very talented daughter, and also relating it to the third generation. So it's a kind of a living experience of a first generation father raising a second generation daughter, and then the second generation daughter raising another daughter.
And how we passed on some of your trauma. You passed on your trauma to me, and then I passed it on to my daughter.
See, when you come as an immigrant, there are lots of, I will say, trauma, stress, anxiety, and adaptation, if I could use the word, when you come to a culture, because you don't know what is expected of you. You don't know how you're going to cope with those expectations. But as you know, that gradually you start modifying your behavior that you bring from India to the expectations. And interestingly, you start becoming more stable, more adapted, and sometimes more even aggressive.
Well, there's a tremendous amount that we learned from working with each other. It's been amazing in that we've had a lot of conversation. My father has obviously talked about his trauma from his past, and he can discuss that.
Well, by talking to you and by listening to you, I think that you have a tremendous in-depth knowledge of trauma as a construct trauma as a applied functional thing, and using that particular concept and how does it affect the behavior of normal people or people who are immigrant was very clear when I talked to you.
And we also constructed, my father and I constructed a cultural genogram, and that also depicted everything too. So starting with my father and the trauma he inherited from his father, to then it being passed down to me, which was around the academic achievement and not being good enough and core beliefs around that, to that being passed down to my daughter.
By talking to you and by knowing your coping strategy, I was surprised at how I kind of kept away some of those things that caused trauma to me, kept them away from you, and you grew up without those stressful events that caused trauma to me.
So, what are we hoping that the readers will gain from this experience? Is that we want you to know that when we're working with a multicultural or a specific demographic like the Punjabi-Sikh diaspora, there isn't going to be a one size fits all. We're going to be using a decolonized approach to working with this population. We have to be patient with the process, and that means we have to give our clients time for them to share their narrative. Otherwise, they may feel rushed and they may not want to share and they might withdraw from the process. We need to lean into Eastern wisdom, and that's something that we're trying to integrate more in our graduate studies programs. We want to, draw from more healing and suffering kind of paradigms. And we also need to be familiar with our clients' cultural history. So that means we have to ask questions with intention. We might be able to use a cultural genogram, or we might even ask them about their past narrative, whatever it is that they feel comfortable disclosing at that time. But we had a really good opportunity working with each other. And, we have different ways of, conceptualizing trauma. And sometimes, like my father has mentioned over and over again, it was difficult for him to name it at times. But having done this chapter,
Yeah,
were you able to name the trauma more so?
I think I was very successful in pointing out the trauma and the implications of the trauma, and how and why it should not be passed on to the second generation.
Exactly.
And by becoming aware of the issues, I was successful in not kind of again forcing my children to go through that. And also, I thought that rather than stressing academic, I was interested in making them learn more about the as Huxley will say, non-verbal humanities, like gym and other such things.
Okay, so we hope that you do enjoy this chapter and you are able to learn from it. And we look forward to, hearing some feedback around it if you choose to do so. And thank you once again for watching our video and reading our chapter.
Thank you once again.
Thank you. Bye-bye.